My name is Colonel John Mcgoldrick, and I'm the 157th Air Refueling Wing Commander. I'd like to begin by reading a few reminders, some introductions, and the format of today's meeting. The reminders are to turn off your cell phone or place them in silent. Bathrooms are going to be out the door here. Take a left, and they'll be on your right. And as far as emergency exit, it's the same door. Take a right, and there's a door in the back on each side of the hangar. I want to welcome back all of our former members to the wing that are here today, and thanks for taking time out. I want to thank our representatives from Senator Shaheen and Hassan's office, Congresswoman Shea Porter and Custer's office, and Congressman-elect Papa's office for attending today. I'd like to read to you a list of our state and federal partners we are working with, and many of which are here today. I also believe they're up on the walls. Department of Veteran Affairs, New Hampshire Department of Health and Human Services, the State Epidemiologist, New Hampshire Occupational Health and Surveillance Program at UNH, the Dartmouth Cancer Registry, New Hampshire State Office of Veteran Services, Air Force Director of Occupational Health Policy and Programs, Air Force Civil Engineering Center, the National Guard Bureau General Surgeon's Office, the Air National Guard Occupational Environmental Health, and from our own wing, we have our Bioenvironmental Office, our Public Health Officer, and Industrial Hygienist, as well as our Wing Safety Office. To my left, we have a table of some of these members. I'll introduce the four of them at the table. We have Amanda Goulet, our Base Industrial Hygienist, Karen Craver, New Hampshire Department of Health and Human Services, Dr. Carla Amenti, from New Hampshire Occupational Health and Surveillance Program, and Major Derek Medizi, our Base Public Health Officer. I want to welcome our distinguished military guests, the Adjutant General, Brigadier General Michaelitis, the Commander of the New Hampshire Air National Guard, Brigadier General Ferris. The purpose of today's meeting is to hear the health concerns for our present and past members, their families, or anyone else that attributes those health concerns from working or living on the base. The information we receive today will be taken back to our working group to develop an action plan to answer as many of your questions or concerns as possible. This working group is made up of the members of the wing, retirees and family members, the state and federal agencies that you see represented here today. We've established a registry through the Office of Veteran Services to help us disseminate information and to keep you up to date. The director of the New Hampshire Office of Veteran Services, Mr. Bill Gaudreau, as well as Jamie Cummings and Cynthia Fisher are off to my right. They're here to take your contact information. Please note that this is not a cancer registry. It's just a way to disseminate information on this topic. We will also post information on our social media sites that would include Facebook, and today's meeting will be recorded and uploaded to YouTube. Let me briefly tell you a summary of how we got here. In August of this year, we heard some health concerns, particularly about cancer, from our retirees and family members in an article written by Jeff McMenemy with Seacoast Online. Since then, we've met many times with our retired members, their families. We've heard the concerns which have centered around the drinking contaminated water or exposure to industrial chemicals, both leading to what is perceived to be an increased amount of cancer in our retiree population. I also don't want to miss the opportunity to thank Vivian Lee from New Center, Maine, who's been very helpful in getting the word out. In August, we assembled our Occupational Environmental Health Working Group, made up of our Bioenvironmental Office. And this group reached out to our state and federal agencies that we're partnering with, as well as the Air National Guard and the Air Force, to bring focus to these health concerns. This working group met in early November, and from this meeting, they scheduled today's listening session, established a registry you see off to the right with the New Hampshire Office of Veteran Services, and we received support from a congressional delegation in a letter to the Department of Defense and the VA asking for their assistance at looking into their concerns. Is there any way we can pull that letter up real quick? There it is there. We can send a copy of this letter out if you've entered into the registry, but we really do appreciate their support. As far as today's meeting format, we're at the beginning of the stages of looking into what it is that is wrong, and we need your help to define those concerns. So today's meeting is a listening session. Please don't expect we have many answers or a presentation to give you today. We have 3 microphones set up for you to use. We'd like to hear your health concerns or stories you would like our working group to be aware of. I ask that you limit your time to 5 minutes per person, so we allow everyone to speak, and only one person speaking at a time. If you feel comfortable enough, it would be beneficial to have your name or the name of the individual that you're speaking about, where they worked or if they lived at the Pease Air Force Base, the time frame that they were here, and what their health concern is. Additionally, if you have any action items you'd like to see happen. Please stick to the topic at hand and help me keep the discussion moving in the right direction. We want to have an open, respectful, and productive conversation. Again, this is not designed to be a question and answer period. Our panel off to my left may ask some clarifying questions of you so we can better understand the challenges. I want to acknowledge that this is an emotional subject. None of the stories that we will hear today are good. These are our coworkers, our friends, our family, and they are either facing or have faced health challenges. The concept of Fort New Hampshire is a long-standing tradition in the New Hampshire National Guard. I believe that dates back to General Clark or General Blair. And the concept is to take care of our own, to include any service members, past or present, and their families that reside in the state of New Hampshire, and provide them with the resources and services that we have available. We aim to continue that tradition today. We have a note taker to capture the concerns. We'll also have paper and pens available to write down any comments or concerns if you don't want to go to the mic. I believe that is over on the table here. Does anybody have any questions about the format before we get started? Doris, I'd like to begin with you, and I'll start with a thank you, Doris, for all the work that you've done in bringing these concerns to our attention. If you want to use this mic or any mic that's out there, do we have a microphone for Doris to be able to use? I think we got one coming over. Kevin, you going to pick one up? Let's have one microphone just so we can readily bring it out to people.
Good afternoon. My name is Doris Brach. I am the wife of deceased Chief Master Sergeant Kendall Brach. And I'm not going to go through my story because I think it was publicly visible to most of you for the last 4 months. So I'm going to say something a little bit different. I want to sincerely thank you for all attending this community listening session. This is about you and for you. I really hope that you participate in this session, ask your questions, and contact us anytime. Colonel Mcgoldrick, thank you for jumping on board. I can't thank you enough for your visit and getting this session started for us. Thank you to all the participants who are seated here. My friends sitting in the front row here, my other cohorts in trouble. And of course, my son and my daughter for joining me this afternoon. I want to thank the legislators for submitting that letter. That's an important piece of legislation, or at least an important piece to get things moving at with the Secretary of Defense and with the Secretary of Veterans Administration. My original goal was really to get the Veterans Administration to recognize disabilities for our National Guard and for the military for serving. Very similar to that done for Camp Lejeune. And the reason why I started this process was when you look at the Camp Lejeune timeline, that timeline took over 35 years for them to approve presumptive disability for the people who served at Camp Lejeune. I don't want to wait that long for us. It has to be faster. We've lost a lot of really good people, and we have a lot of people who are sick today that are being taken care of. So that is the reason for getting together here and listening to your issues. Ask your questions. This is your place. There are a couple of other meetings going on I'm not going to tell you a whole lot about them, but there's a community action program, which some of you may know about or not know about, depending on if you listen or read things about water contamination here in Portsmouth. And I'm dry. The community action program, I actually got involved last August, and my plan is to attend those meetings, and that really is for the PFAS and PFO water testing that's been going on. This meeting and this listening session is the military component because we have something else in there besides just the PFAS and the PFOAs. We have the chemical exposure as well. So that's why it's a different session. But please get involved in the community action program if you can, because there's a lot of good information being disseminated there. The other is the Restoration Advisory Board. The Air Force runs that session, and they keep everyone abreast of how they are remediating Pease Air Force Base from the chemical contamination. So those two meetings are going on today. They continue to go on every single quarter. So, take a look at those. Most importantly, people can make a difference. Obviously, we were just a group of a few spouses who, were interviewed in a newspaper, and look at the people sitting in this room today. I have to tell you that I am blown away. And I want to thank each and every one of you, for attending. So I hope you can really express your thoughts, and we hope to get back to you. I just want to thank you from the bottom of my heart.
Hi, everybody. Most of you know me by the name of Cappy. I was stationed here in 1992, and I retired in 2015. Since my retirement, I've had nothing but issues. I've had surgeries, and nobody can figure out what's going on. I've had 3 colonoscopies. I've had multiple CT scans. And to this day, each time, and it's probably going to gross you out, each time I use the bathroom, I bleed. It's not normal. And I've been told by the VA that each time I go to the bathroom to take a picture so I can photo stamp. I bleed every time I go to the bathroom, and nobody, no doctor can tell me why. I have issues with my liver. I have issues with both of my kidneys. I have kidney stones constantly. I have gout. I have things that I've never had or experienced before, and nobody can explain to me why this is happening. I changed my diet. I do not drink. I don't have any alcohol in my body. I do not take drugs. I do not use pharmaceutical pills at all from any CVS. I don't even use pills. I take ibuprofen. I don't smoke cigarettes. I'm about as clean as you can get, and I still bleed. I can't tell what's going on, but when Doris brought it up online, now it's starting to make sense to me. Can I pinpoint it out what's going on, what we're talking about here today? I don't know. But there's something going on with me, and I want it fixed. And the VA has been doing a great job trying to find out what it is. Nobody knows. But I'm still bleeding today. Thank you.
Thanks, Cappy, for sharing.
Good afternoon. My name is Lou Archambault, security police when I was here. I was assigned to the 45th Air Division, and any jokes with this, but one day I wasn't doing anything. And it was in 1989 I was asked, this was during the closure period, I was asked to find out where all the hazardous waste areas were. And I went over to civil engineer, about a gentleman who was civilian, but he was working on, the hazardous materials that were there. He was kind of surprised that I was asking for him to show me where all these things were. And so this was 1988-89. I got a photographer and a cherry picker and went out to all the sites and took pictures. When I gave the presentation to the base commander, basically, he didn't want to really hear it because he couldn't say this stuff. Near the control tower was the hydraulics building, Doris's husband there. There was an underground tank. Well, not exactly. They did pour hydraulic fluid into a drain. It had been poured in there since the beginning of Pease. There was no tank. It was going straight into the aquifer. In mid-'80s, there was erected over the south end of the runway to mix water from. Huh?
I think it's still on.
Okay. So it was being mixed to kind of dilute it. So that was even before me going out. There are other places on the other side of the runway where it's a runoff that went into a concrete type tank, several tanks with supposedly filters. Between that and the next spot for that to go was Peverly Pond area. And so there's an awful lot of, damage has been done. It's been known for 30 years. All right? Thank you very much for your time.
Thank you, sir. I will tell you, though, Air Force Civil Engineering, the Brach Committee, they have identified many of these spots. There could be ones that you're bringing forward they're not aware of. They have identified Pease as a Superfund site because of all the pollutants and practices that were done in the past. They've also, today we do have our water tested and it's safe to drink. But we didn't know about, for instance, PFOS, PFOA prior to, really in 2014 is when they shut one of those wells down. So there's certainly more to the story. I appreciate you sharing.
Thank you. I wanted to speak now because I'm kind of a follow-up to the gentleman before. My husband was a crash rescue fireman in the 60s, and his job was to set fire to all the garbage. They had all the oils, gasoline, paint thinners, anything that would burn pretty much was dumped into the ground quite close to the Haven Well at the end of the runway. And the training for crash rescue was they had to go in there and put out the fire. They would set the fire, and these guys would walk into it to see how long it would take them to put it out. This was done every 3 weeks. And I have in my hand an Installation Restoration Program record search for Pease Air Force Base from 1984. And it was well known that this water was poison. My husband and I would drive over Newington Road towards Newington, and he would start to swear because of the blackened grass that's now covered with plastic, and also across the street, the dead trees, the ponding of fuel in someone's backyard. There was a house over there. The trees were all dying. There was definitely a problem. And I went online and I got a copy of the record search, the restoration program, and I was shocked to read everything that was done. I'm not a chemist, so I can't really go into it, but this well was poisoned for a long time, and I don't believe there was any way to clean it up. I would not drink the water today. I did go on the tours that Pease offered, and I asked them, they showed the crash rescue spot, and I didn't think that was the right spot, and I said, no, I would like this busload of people to go to Newington Road, and take a little ride so I can show you the exact spot where my husband burned these solvents. And they said, that will be our last stop. And as we got closer to the end of the trip, seeing the new restoration for the well and all that stuff, I had a bad feeling, and they said, "We don't have time for the last stop, I'm sorry." And that really bothered me. I felt between the plastic over the dead grass, the cutting down of the dead trees, I wasn't allowed to take pictures. There was a truck there. He got out, told me I could not take pictures. And then the trip that I took, hoping to see that spot, and the people in Newington know exactly what that spot is. And for them to say there was no more time to go to the last stop really bothered me. And I felt that there was no truth in anything I was finding. I found this restoration project accidentally because I was looking for other firemen that had died, crash rescue guys from back in the 60s. And I know that's a long time ago, but if you talk to a chemist, these chemicals do not go away. I don't care what you do. They don't go away. Once they're in the ground, they're in the ground. I'm not here to put the Air Force down. My dad was career Air Force, and I'm really proud of the Air Force. But I'm not proud of this water situation. And what I feel was a cover-up, maybe because they think it's going to be money or whatever. But my husband got cancer eventually. It took a long time, but no one in his family ever had cancer. And he died quickly. He never connected it to this job. He would come home in his fatigues, and he would take them off and hold them like this, tell me not to touch them. He said, "Don't you ever touch these." He'd put them in a garbage bag, take them back to work, back to Pease, and wash his uniform at work. I feel it was a very dangerous situation, and that the well is not safe to drink. People in Newington are complaining, and I know if we think about the money, it's not about money. These people, Great Bay, all the animals in Newington, the deer, the fish, it's under a study. But I don't even believe in the study anymore. I don't think anyone really wants to know the truth. And I want people to know the truth, because my husband had to go in there every 3 weeks for 3 years, and he got out on a hardship because he couldn't take it anymore. And the fire foam, he was using fire foam. He was in an asbestos suit, and I called the Firemen's Museum, and they said those were never tested when they were wet. And my husband's fingers would be burned through the asbestos gloves when he put the fires out. So if there's any way to get rid of the Haven well, just get rid of it. Shut it down, never open it again, because I don't believe it'll ever bring you clean water. And I don't know what you can do about it. I apologize, I'm not your enemy. You need to know the truth. You need to really look into it, study it, talk to chemists, read this restoration project. It was online. I brought it out at the last meeting of the PDA. And I asked people to go ahead and pull it up and really read it, because it's shocking. I mean, it's really shocking. And it makes me angry. Angry for my husband, for my children, for all of us that lost him 20 years ago. And I had to get up here and say this. This is just something that should never have been, you know? It really shouldn't have. And I'm not blaming anyone here. Probably none of you knew about it, I don't know. But this is a real document, and it was supposed to be cleaned up. There's an order in this document not to transfer Pease to the city of Portsmouth until that cleanup was finished, until they could prove the well water was good. And it's never been good. I've lived here a long time. We came to the base in '57 with my father, and it's just not clean. It really isn't. I don't know what else to say. If you have any questions, go online. Some Air Force gentleman at the meeting, the water meeting, told me that it's against the law for them to take this offline. So everybody should be able to read it, and it's very important. It's really important for all of you to know this. And even you, sir, I don't know if you know about it, but I was blown away with this report. I have copies of it, and I highlighted everything. And I was determined to bring it out to all the people that need to know. And I think all of you do. I don't know what else to say.
Ma'am, do you mind your husband's name and the cancer he had?
Edward McCurry, and he died of bile duct cancer. He did live to be 56. There was no cancer in his family. There's no cancer in my family, except for my brother, and he was a scanner at Logan. He was the head of scanning, and I believe that's what happened to him, but there's no cancer. And he was in the Air Force for 3 years. Like I said, he put in for a hardship because he couldn't take it anymore. And I wasn't trying to cause trouble. I went online, like I said, looking for friends of his to see how many were dead. And I found 2 that blamed their job. But I don't know what to say. But
Thank you for sharing the story.
Oh, yeah, you're welcome.
Good afternoon, Colonel. Name is Perry Forgione. I was a member of the 509 Security Police Squadron here from 1980 to 1983. I lived in based housing with my family, and I can tell you, on a monthly basis, somebody from the hospital came and tested the water in based housing, and we all wondered why. We started to look at the water. Myself, I have a medical background. I was an EMT and an AEMT out of New York, and an EMT at the time in the security police. And we took my son out one day to Peverly Pond, and the water was dark. So I told my wife to never take him to the pond again. And I started doing some research with some colleagues from the OSI, because when they came out to test the water, we would get kind of harassing phone calls. My wife was pregnant at the time. That leads me to, my daughter was born with spina bifida, birth defect. She's no longer here. But both my children after that also had different defects. It turned out in my research, 1 out of 500 children here at Pease Air Force Base at the time, in 1980, were born with birth defects, and we couldn't figure it out. 1984, I was transferred out of the base, and I said, when I heard about this, I said there will come a day when they will realize that there was contamination here, and it was known. And for some reason, they just, just kept going. Never made the Air Force population aware of it. But there are people in munitions, people in aircraft maintenance that had children, enormous amount of birth defects. And all you have to do is go back and check the records. And I feel, as well as my colleagues that are here, that it has to do with the water, because we drank it, we bathed in it, and the children swam in Peverly Pond. Thank you.
And sir, the years you were talking, living on the base was 1980 to 83, is that correct?
1980 to 1983, and they would come around in base housing from the hospital and test the water. In all the units, not just mine.
And you were in security police, is that right?
Right, security police shift commander. And Sergeant Archibald was my flight chief. I saw the pits behind the North 40, the settling, they used to call them the settling pits for the JP-4. And that's actually right behind Peverly Pond. And they had some sandbags around them. And, there was no remediation at all.
Thank you for sharing, sir.
Okay.
My name's Bob Megan. I am a retired lieutenant colonel. I served with both Lieutenant Colonel Forgione, who was just up, and Senior Master Sergeant Archibald. who told you about the research he did. We all knew about this stuff back in '79 when I came here as a shift commander. We also started tracking, I specifically started tracking in 1982, 83. I had 90 men on my shift before I got promoted to captain and became ops officer. Day flight. Out of those men, 17 of them had stillborns, miscarriages, or the type of thing that Perry just mentioned. Myself and Lieutenant Colonel Forgione were the last two to lose kids out of that. But just today, I got a word that one of the other guys has come down with cancer. The stillborns, deaths, etc., in my opinion, because I talked to my friends, my tech reps, I was a senior nuclear weapons convoy commander here, and MMS was having an enormous problem, just like the cops were. We were around the nukes all the time, and in fact, in '82, they had my picture up next to 2 racks of SRAMs while I was giving the tech brief at the SAC ORI out brief. And they had all the outstanding performers' pictures up there, and there I was in front of the SRAMs. Shortly after I left Pease, my wife was pregnant when we left. We were the last ones to lose a child out of that group that I had. Every one of those guys, because I was IG after I left here, I was able to track most of those guys when I'd go from base to base. Everyone had normal children after they left here. And shortly after, I was complaining before I left here that we thought that the SRAMs were having problems. I was doing switch outs all hours of the day and night. They were having difficulty with them. I was told if I followed that up, they'd pull my security clearance. And I went on to headquarters. As I said, I was chief of nuclear security. I was one of the 15 people they brought in '02 to rewrite the nuclear security standards and at DC. And all throughout that time, one of the things that happened shortly after I got to headquarters is all of the SRAMs were pulled. They were mostly at the 2 FB-111 bases. And strangely enough, the birth defects, et cetera, went down. I later found out through the grapevine that the SRAMs had leaked, and it was probably radiation that caused the problem. As for the water issue, I was brought back here several times. Not only did I close out the nukes here, but I also closed out a number in between. I closed out K.I. Sawyer as the last base in the Air Force with aircraft nukes. In addition to that, we all knew about the water, as Perry and Arch both stated. We all knew about the problems here. We were all complaining. Just before the base closed, I was the battle staff commander here. I got brought back in. I was a reservist at that time. And I got brought back in to run battle staff. And on 3 different times as battle staff, I got word that they were trying to figure out how to properly word that the water was contaminated. And that was back in the middle of an ORI. And they knew this. And I think everybody knew about this at the time. And I get it. That was the middle of the Cold War. You didn't want a lot of problems. But it's long overdue. These folks all lost somebody. The stuff that's gone on, the things that people are talking about here, everybody knew about it. And it's time that somebody did something to help some of these troops. As I said, one of the guys I just found out this morning, real healthy, all of a sudden he can't even work anymore. He's got cancer, no cancer in his family. And I used to keep close track on these guys. I met them every day. There was 90 of them. And they're dropping like flies. So, that's all I have to say.
Thank you for sharing. I have a couple questions, if you don't mind.
Go ahead.
I believe you did 2 tours. Is that right? 1979 was the first time?
I did 79 to 83. I was here. Then I went to 15th Air Force headquarters, where I was chief of nuclear aircraft security. I stayed there until 86. Then I was transferred to the reserves, but I was an IMA. I was assigned to active duty bases, principally as a commander, brought in to fill in as interim commander at different security places. K.I. Sawyer being one of the last ones. I was at Pope. I was brought back I did George Bush's security. I oversaw that. You had to have a major or a captain or a major So I did that for years here.
Did you come back to station at Pease Air Force Base or not?
I came back to help close out the nukes as a reservist.
Okay. And then just so everybody understands, when you say SRAMs, we're talking about nuclear weapons.
Short-range attack missiles, correct.
Okay.
Any other questions, sir?
Oh, thank you, sir, for sharing
Thank
your
you.
story. Do we have a microphone? Thank you, Taylor.
I was glad to hear about the 80s because my husband, Wayne Peralt, was here for 20 or 22 years, retired, I think in 88. We were married in 2008, so it was a marriage that was a little bit later for us both. Whoops. I don't know how to do this. Do you know how to do it?
Did we lose the mic?
It is working? Okay, thank you, sorry. So the only thing in his family that was of a medical issue was that his father died young at 57. There was no cancer in his family on either side, either his mother's or his father's. So because of the heart condition, we decided to go to a heart specialist to make sure that everything was okay with his heart, and if not, we would do whatever we could to take precautions about his dying from a heart attack or a heart issue. So when the doctor said he was very healthy, whatever he was doing, he should keep it up. He was a very conscientious eater. He exercised every day. 14 months after we were married, he wasn't feeling well, went to the doctors. 4 days later, he was diagnosed with stage 4 cancer. So it was his spleen, his liver, his stomach, and his pancreas. The tumor actually started in his stomach, and it moved fairly quickly, I guess, up to his pancreas, because initially they weren't sure if it really started in the pancreas or the stomach. And so when I say really quickly, this probably was in his body for many, many years. And when it got active, it really, after he was diagnosed, he died 2 months later exactly to the day. He was 67 years old. As I said, we'd been married 16 months. It was heartbreaking to both of us because we truly had hoped for a longer time. So he's been dead now for almost 10 years.
Ma'am, do you know what occupation he had while he worked on the base for those 22 years?
I really don't. I have some papers about his discharge, but I don't know.
We can find that out, ma'am.
Okay. So Wayne Peralt, P-E-R-R-E-A-U-L-T, the love of my life.
Thank you for sharing.
Hi, thank you, sir, for hearing us as well as the rest of the panel. I first came to Pease in 1984 as an environmental support specialist, working with the water at Pease as well as the wastewater and demineralized water for the aircraft. I lived on the base till 1987, at which time I got married and continued to work here until the base closed in 1991. I left in March. Continued my Air Force career out at March Air Force Base, California, and then joined the New Hampshire Air National Guard about a week after the planes hit the towers and have been here ever since. Back in the 80s, they were worried about TCE in the water, trichloroethylene. They built a new water plant. The Army Corps of Engineers built a water plant, and it never worked as designed, but it did aerate the water, and they said that dispersed or released the TCE at the time. In 2005, I was diagnosed, luckily, a persistent primary care physician, a regular routine physical. He found a trace of blood in my urine with one of those sticks, and he really chased it to the end. He thought it was for, because I was working out that day and stuff, but it turned out I had transitional cell carcinoma, bladder cancer. I was treated for it, continued, my regular checkups for about 10 years. Then this past June, I went for a regular physical. My doctor was like, hey, when was the last time you seen Dr. Michaels? I'm like, it's been a couple years. I go, 10 years cancer-free, I think I'm good. And he goes, you really got to go see him. I go, yeah, I'll get around to it. Well, my doctor, how he is, he made the appointment for me, and sure enough, they found another tumor, and it was bladder cancer again. Just finishing up those treatments. There's no bladder cancer history in my family. 40 years old is a pretty young age to be diagnosed with that. I'm lucky, and I would encourage any of you people that spent a significant time in the 80s, in the 90s, make sure you get screened, because you want to catch this stuff early. The screenings aren't pleasant, the treatments are worse, but you want to catch this stuff early. And if it is indeed, related to the water or another carcinogen that we're exposed to in the industrial world that we lived in, you want to get a hold of it early. So that would be my advice is, get yourself screened and get it early. Thank you. Thank you again.
Thank you. I appreciate, especially in uniform, you sharing that with us. And I certainly would encourage anybody else that's a current member to tell their story as well.
Hello, sir. Wayne Dyer. I'm retired from ComFlight. Stationed here at Pease, active duty from 84 to 89. Got out in 89 and joined the Guard. In regards to health, I was diagnosed with cancer 1 year and 1 month after retirement. Luckily, as you can see, I'm healthy, but the doctor did tell me chances are another form of cancer would come back. My question would, for any retirees, other people here, how many people possibly have had cancer that, in my case, I'm the first person in my family to have had cancer. I've always been told I'd die from a heart attack first, so, whatever. But my question would be, how many retirees here or active duty, besides that, have had cancer or have had scares with cancer? But like I said, diagnosed a year and a month after I retired, so.
Do you mind sharing what type of cancer that was?
Hodgkin's lymphoma, so is my lymph nodes, which my understanding is it's a childhood cancer. So the doctor was very surprised that actually I had it at my age of, at that time I was 48 when I was diagnosed with it. And I did live on base housing for a while, but like I said, basically from 84 till 2007, I was stationed here at the base, AGR technician, all of that stuff.
What would you like to see done?
Well, I'm not going to say I blame the water. Who knows? It possibly could be. I would definitely like to have some answers on it. The fact that cancer isn't a trait in my family. I'm more concerned for, I have a supervisor at my company that I work on the base. His daughter went to the child center that had the well water. They were using the well water that was contaminated. His daughter was in that school for 5 years. My concern would be more for his daughter, who's now 7 or 8, ramifications down the road, maybe 20 years from now, what health issues she might have. He did have her tested when the state was doing the blood work, and I asked him about it, and all he would say is, my daughter's blood work came back that she's, and I can't remember what they're testing, but she was extremely elevated numbers that they were like, she's got way too much of whatever the thing they were looking in. So being older, it's not so much for me, it's more for the people that did have children, as was identified, the individuals that their children were born with birth defects, but people that have been using the daycare, what they could expect down the road for their children, or possibly grandchildren if, you know, depending on medically what may be going on. But,
Thank you, Sharon.
yes, sir.
Tony LaBelle. I was 7.5 years active duty, joined in '93, came to Pease in 1990, and I have to say right now, thank you, Doris, for what you've been doing. She's been really a lion in this thing, and her family's been really supportive of her, and I have to thank you. This is a big deal. I'm not only concerned about the Pease issue, sir. The EPA has a registry as well, or sites that they've identified, and there's 126, I believe, sites that have been identified as far as bases go. They're all branches, and my concern right now is I was stationed at least 4 of the bases that are on for the Air Force Base piece. And I have some issues going on with dermatitis type stuff and degenerative disc disease. I have certain things happening. I was a fire truck mechanic for years, exposed to the foam, all 3 types. Back in the day, they had a protein foam back in the 60s. And, you know, as a going away because the stuff really smelled bad. People used to get doused down as like a champagne hose down type thing. And it was a ha-ha thing. You don't know what you don't know. And yeah, I was part of that deal. I got hosed down several times by the fire trucks, just because I was a mechanic. There were other practices that were done as well. Now, these are at different bases, mind you, and Pease is no different. The gentleman talking about the hydraulic oil in the drains. I know of people washing floors with JP4, jet fuel. Worked great. Washing their hands, dip their hands in the PD 680 tank. This was before people didn't really, you didn't have the protective stuff going on because it wasn't being recognized for that thing. It was just washing up, and people were exposing themselves to it because there was really nothing that they knew was going on. That's the environment. That's
Chief, what years do you think you were talking?
We're talking in the 80s, and I believe it was the early 90s is really when they started the right to know. And that's when the MSDSs started coming up. That's when we started taking a look at how to protect the individual. And the Air Force has always been really good about that. Once they identify the problem, they start taking care of the problem. The problem is what about the people that were already there? Hence the people from the 60s, 70s, 80s, and even further back. I mean, just looking around, we have people that have been exposed, you know, with the dermatitis type stuff. People can't even get around the jet fumes. We have fumes that are going around. We have asbestos. We have all these other things that are floating around. I mean, it's a hazardous workplace. It's an industrial environment. So where I'm at, where I started getting worried about the water was back when we moved into the building that I had worked in for 28 years or so. Started out when we were hosing down floors, water smelled. It's like, well, it's in the piping. So, today, drew some water out. and I shake it up, and it suds up on the top, and it's still rank. We've already identified it. It was tested, and it came back okay. But anybody wants to know, that's when I started not trusting the water. I don't know. My kids went to the daycare center that we were talking about, and they have some heightened cholesterol issues. One of them does. I'm concerned for them. I'm concerned for everybody that's been exposed to this stuff. Chief Brach, I was there through the hard times with them and saw him fight this thing. And I can tell you, you took a strong guy and really knocked the living daylights out of him. You watch him go down. And he was concerned too, but he was proud of his service, and he really didn't want to push the issue, and I kind of pushed him to try to get in contact with the VA. And so the bottom line is like Cathy was saying, Dave was saying, you got to get checked out. You got to get looked at, and that's what I'd like to see happen, sir. We have people that have been exposed, whether they're full-time, whether they're part-time, whether they're former active duty here at Pease. We have people that are working over in the state shop that we've lost. You know, you got all the, I'm not telling you anything new that you don't know, but you got all these employees here. We have been here longer than most of the people like Lonza and all the rest of the folks. And a lot of people made their careers here. And, you know, I just hope to see it recognized by, for the military folks, hopefully the VA can do something where they'll recognize something that's going on. If that can get pushed, that would be great. I don't know what else can really happen, sir.
So, Chief, when you are talking to a medical provider, do you feel like it would be beneficial to have a list? You started going down the path of exposure to chemicals. Would that list be beneficial, or maybe the results of if you're exposed, to give you a healthcare provider so they maybe have a little more scrutiny of what to look at or test to give someone for early intervention?
Yes, absolutely. I went to the VA and I told them, I said, listen, this was past practices that I've been exposed to, blah, blah, blah. And they're like, well, we really can't do a whole heck of a lot for you. Where were you at? I told them, you know, where I was at, and primarily here. And they were like, well, it's not recognized on any type of registry or listing or anything, so we really can't do anything for you. So that kind of irked me a little bit, and you know that I'm a quiet guy.
But do you feel like, though, with that knowledge, you might be able to get a targeted test, for instance?
I think that it would be. If we can arm them with the information of basically identifying where you've been, that may be suspect, I think that would go a long way in helping on taking care of the members from, from National Guard or not. I mean, everybody here on the base, we've all been subjected to the water. I mean, we're sitting on top of whatever God what knows. We have an opportunity now that we can help the folks that are here now. And I'm concerned about those young folks that are out there. But also the older generation that's been subjected to the stuff that I was subjected to because we didn't know what we didn't know as well. And yes, we took mitigation to take care of this stuff, but some of it may be too late. Like they said, it may come out years later. So yes, if you can identify Pease as a hot spot, like I said, I've already been to 4 other bases that are on that list that were hot spots. That's on the EPA site. That's not in the VA site. So you know, it's got to be recognized between the agencies. That would be a big deal, I think. It would go a long ways. I mean, just look at the folks listening to these horrible stories, like you said. They're going to be bad stories. They are. And, you know, I had one of our honor guards guys say, just promise me that within the next 5 years that I'm not putting you in the ground. So you just don't know. And I think that if we can identify this so that our folks that have put in a boatload of service, whether they were here for 1 weekend a month or not, we've all been drinking the water. We've all had the ice cubes out of the club. We've all had the whatever events that we had going on, whether you were taking a shower in it, drinking it, dining hall uses it. This water stinks, and it's part of the domestic water that comes out of the building. Maybe not out of the tap, but if it sits for just a little while, it gets pretty rank. And I've always been suspect of it, and I've always tried to steer clear of it, but then you don't think about it when you're having a cup of coffee. So just want to be there, make that aware. That's my concern. I don't know what the future holds, but I do have stuff going on.
Thanks, Chief. Sir, we'll come right back to you.
Can you hear me?
Yes, ma'am.
My name is Cathy Northrop, and my heart goes out to each and every one of you who have been affected by this. My husband, Russ, was a pilot in the National Guard here from 1978 to about 1991. We've talked a lot about cancer affected, you know, that many people have gotten. I'd also want to bring attention to neurological diseases. About 7 years ago, he started to get what we thought was Parkinson's disease. He started to have balance issues and, you know, difficulty walking. Long story short, he had a disease which was under the umbrella of Parkinson's called PSP, called Progressive Supranuclear Palsy. And they believe that this disease is caused by exposure to toxins. It's not something that may show up right away, maybe like cancer, but I think it's something that we need to be aware of, and for those of you who work at the base, it may be a disease similar that might develop in years to come. So I heartily recommend that anyone who has Parkinson's or something similar to that to maybe note that and become part of the registry. So thank you.
Thank you, ma'am. Sir, did you want to go next? Well, I think the microphone's coming right here.
Okay. Hello. My name's Maria Menez, and I was in the Air Force from 1978 to 1998. When I was stationed here at Pease, I was Staff Sergeant Perez. 1984 to 87, I worked in the 509th Bomb Wing in the intelligence unit. While I was stationed here, I lived on base on Woodbine Terrace, and both of my children went to the elementary school. Since retiring, I've had a lot of health issues, and retired with 60% disability rating, and have since gotten up to 80% disability and 100% unemployability. I have used the VA Medical Center in Manchester and Somersworth since 2001. And with every single health issue that I have, the biggest frustration I have is no one knows what's wrong with me. It doesn't matter what the pain is, what the symptoms are, no one knows what's wrong.
So you don't have like a diagnosis?
Well, on a regular, well, some issues, yes, but you know, there's sometimes too where there's things where, why do I have abdominal pain? I'll have ultrasounds, I'll have MRIs, et cetera, and a lot of times they don't have an answer for me. I did actually find out I have degenerative disc issue in my back, which causes pain radiating down my legs, et cetera. Some things I do find out, but I don't have an answer for everything. So it causes me a lot of concern that, you know, why do I have all these problems? And I'm concerned for my children as well, who are adults now, of course, but they have health issues too that now I'm wondering, was this part of, you know, they were just in elementary school and we lived on base, so we drank the water every single day on base, whether at work, at home, or at school. So I just would like to try to get in the loop and find out who to stay connected to get more info and find out, you know, where we can go from here, because my quality of life has been significantly affected, and I would like to be able to work, be able to be productive in society still, and I'm not able to do that. Thank you.
Thank you for sharing, ma'am.
Hi, my name's Gordy Manus. I was never actually stationed here at Pease, but my question or point is really along with the other gentleman, the chief there. I think one of the things that we ought to consider doing is collecting all this data and making sure that we really pinpoint it to the VA so that when people approach the VA, it ought to be something on the lines of, I was stationed at Pease. That ought to send off an alarm for them to start looking for possible things instead of the individual is running down a whole list of symptoms and they're trying to figure out what it was. Maybe if they could start with the fact that this person was stationed at this hotspot location, and they will be then leaning toward looking into it, you know, as to what's probably wrong or could be wrong. So that's my point.
Okay, thank you.
It's on, huh? Hi,
Hi,
I'm Joanne Dion. My husband was in the Guard here. I wasn't going to speak, but the more I hear of allergens that are in the air, contamination, we thought my husband had lung cancer. They went in and did a biopsy on his lungs, and the doctor come in and he said, it's not cancer. But he hugged me. He said, your husband has idiopathic pulmonary fibrosis of his lungs. So we went, I'm just thinking of other people. When you said that maybe the VA should know other things that might be going on, his lung disease, idiopathic, they don't know what causes it. He loved his job here. God, he loved his job. But, you know, so we went to see another doctor, a pulmonologist. He said, get your affairs in order. You have 3 to 5 years to live. God has been on my side. He's going on 7 years now. His quality of life is diminishing. I treasure every day I have with him. But I just think that that should be added to the list over and above the cancers, that it is idiopathic pulmonary fibrosis. And I appreciate everybody that's here. Thank you very much.
Ma'am, do you mind just sharing where he worked and the dates roughly? Or sir, if you could.
Yes, I worked in the airframe repair from 1981 to 1990.
Thank you. Thank you for service.
Thank you.
Kevin, I think over here on the right.
My name's Jeff Adams. I was stationed here. I finished up my career here, but I was active duty before I came over here. I got caught in the Brach. I was a finance guy. Now, I heard a lot of people talking about how they haven't recognized at the VA what happened here with the water. The first testing here that we know of was in 1977 after the plane crashed, and they were testing the water tables. Throughout that time, when they closed the base, it was finance at the time, and the housing, they were going to turn over the housing to the town. The town didn't take the housing because of the water. That was the main factor. Now, I haven't heard anybody talk about that, but that was one of the main factors. I'm currently the district commander for New Hampshire in District 3, which covers this whole area for the American Legion. One of my officers, young guy, he was a firefighter, he's getting a lot of cancers that they can't identify. And he was stationed here. So it's out there, the VA knows, and they sent out letters to people that were exposed to it. I got one. I don't know who else got one, but as a result, I got to go up to the VA almost every 6 months to get my blood drawn. Nothing yet on me, but there's other people that have seen stuff. We've had a couple people die that I was stationed with because of cancer. And it's not cool. I'm getting a little emotional because they're good friends of mine. But what I'm going to tell all you guys, don't touch the water. Stay away from it. They can tell you it's clean, but the town would not take the properties that were given them because of the water. You think about that. So, and then also, if you live in this district, check your local legions. They have service offices that can help you with all your claims. It's one of the things we're doing a lot with, okay? So I wanted to say, I wasn't going to say anything.
What were the years you were here again?
I didn't come in here until late, but I was in and out of here because I was active duty. Okay. I didn't come here until 95.
95?
Yeah. Okay. But they sent out letters to everybody saying they were exposed to this PFCs. We already know the J4 was dumped right on the runways. We know that. That's how they used to dump them. We know the fire department dumped the foam. Caused a lot of problems with the wells. So that stuff the VA already knows. When I sat on board up there, we're aware of that. But you got to get out there. You got to get those claims in. And I guess I'll leave it with this. It wasn't until 1979 the VA identified or accepted Agent Orange. You think about that. Long time after it was first used. Anyway, thank you.
Thank you, sir. Ma'am, Kevin, right over here.
Donna Hakey, I was here from 1974 until 1993. My husband was here from 1975 to 2000. Backing up on what our American Legion gentleman just said, not everybody was notified of the PFAS or whatever type of testing it was. We have never been notified about any type of testing. Also, the VA is not aware of the problems here at Pease. I've been trying to apply for my VA benefits and have been denied. And I've also brought up about the situation here at Pease. I spent over an hour on the phone with a gentleman from Georgia, and it took him 45 minutes to find something stating about the issues with Pease. He says it is not in the VA registry at this time, and you cannot put a claim in for it. So just to let you know what is out there, I wanted you to know.
All right, ma'am. I appreciate it. Thank you.
How you doing, sir? Hello, everyone. My name's Daniel Peterson. I was originally stationed here in '84, and I spent 24 years here until the base closed, and then was here another 10, 14 years after that, and then was in the Guard for another 10 years after that. So been kind of here for 34 years total associated with the base. I don't know much about the PFAs, but I was here when the TCE was an issue back then. And I just did some quick research about it because I didn't know much about it back then. And like the gentleman from the VA said, yeah, it was an issue at 77, and I found just a couple of documents about it from then. And the levels were originally started because residents had a smell of fuel in the drinking water. And I could go on and on about reading this, and I'll pass this on to whoever may be interested in it, but it had the levels of the TCE at the different wells and the periods it was tested and when it was finally dropped back down. But, you know, it wasn't until, you know, probably the mid-'80s when it finally was getting to the acceptable levels. It's a long time for that to go on. And like my good friend here that I was stationed with, which today was the first time I know it, he was originally, with his cancer, he found it through blood in his urine. And the reason I'm saying this right now is because the last physical I had was a few years ago, and the doctor had told me the same thing. He kind of shrugged it off as like, yeah, it's just probably a bad sample, and I need to say I need to get to the doctor because, yeah, I'm worried. Thank you.
All right, sir. Thank you for sharing.
Hey, Colonel. Thank you for putting this together. Really appreciate it. Cappy, sorry, buddy. I worked here in maintenance facility in this hangar from 1988 to 2010. My name's Dave Makos. When I was 50 years old, my wife haunted me to get checked out for a checkup that they recommend when you're 50, and I mean, I don't even know, I'd never even catch a cold. And she said, exactly, you don't know what your blood pressure is, you don't know anything, you're healthy as a horse, go get checked out. She's a nurse, thanks. So I got checked out and my PSA was high, and you know, just at the borderline or what have you. So my doctor looked at it, and then you get a specialist and all this neat stuff. And this went on, and it just kept elevating, and like somebody said earlier, some of these tests aren't pleasant, and you get checked out, and they take some samples, and it got even higher, but couldn't find cancer. And then finally, after 2 years, they wanted to do it again. Like I said, it wasn't pleasant. I said, do I have a second choice? And they said, yeah, go down to Leahy Clinic, which thank God around here we have some of the best hospitals around, and you can take advantage of that. I went down there, and they knock you out for this thing and making it at least semi-pleasant because you're unconscious. And then I had cancer, and out of nowhere, it was crazy high at the time, my PSA and so on. And you have a recovery time and this and that. And then when I got back to work, I just thought, you know, you work with a bunch of guys, you know, you get prostate cancer, you're a guy, but geez, this is an old man's cancer. You know, I'm kind of surprised. And then, you know, you start listening down the hallway, and it's like, oh, well, General Clark's had that, Colonel Martell's had that, Bruce Nicholson's had that, Chief Young's had that, and Gary Enos has had it. I mean, a bunch of us who've been around a while, we recognize all these guys. And I think I wanted to name off, right at the time, there was like 9 of us had old man prostate cancer. You know, and we were probably, I mean, I was 52, and I think I had it when I was 50, but they finally diagnosed it at 52. And I think most of those other guys that I just spoke about, we all were in our 50s, just crazy, crazy high. And like I say, I try to think, well, maybe we're, you know, mostly, you know, men workforce. Maybe it's not abnormally high, but you know, I start listening to some of these, you know, subject matter and people who have gone through this and different types of stuff. And I saw Mike Plouffe in a newspaper. He's dealing with something. We've lost Donna Mitchell, Roger Broad. I could go on. And I think what I'd like to see going forward is just, you know, what percentage of this workforce you know, has had cancer or, you know, some other issues that might be related to the toxins. I don't know that mine is specifically, you know, related to anything. I mean, there's a lot of us we don't know, but, you know, over the course of 22 years, I was a gym rat. I know I drank a lot of water, and on Flightline drank a lot of water, and we were exposed to hydraulic fluid and oil and aircraft wash soap and PD 680. I don't know, but it just seems crazy high. And the only thing I'd like to piggyback on is I wouldn't be standing here today having this conversation if my wife had not hounded me. I mean, literally, I never got sick. When you guys, gals, get to that point, you know, when you're younger, you don't need a doctor, but when they recommend at 50 you get checked up, or if you have something in your family, don't blow it off. Mine was really aggressive. They did not get it with surgery. I needed to go back for 2 months of radiation. I've been cancer-free, knock on wood now, for a couple years. But when somebody tells you you have cancer, it's life-changing. I had a friend of mine, co-worker here, said, well, you have a very treatable cancer, Dave, and it's true. I did, and it came back. They seem to have it. You just never know with cancer. When you're told you have it, it's life-altering. It's tough, and it's tough on your family. So, like I say, get checked out when you need to get checked out. But if we could just see maybe some statistics, I'd love to just see what it's all about, Colonel.
Well, can I, I'm going to ask a question of our working group then. Can one of you explain to me how, if one of us has cancer, I think automatically that gets flagged, right, in some sort of a registry. There's a way to find that. But I think maybe the missing piece, though, that we can't pick up is if someone had worked at the base. I don't think that's in their database. And if someone gets, let's say they spent their whole life here, they moved down south, warmer weather, in their retirement years, they have cancer. I don't know if it comes back to our state where we can capture that. Could someone speak to that?
Yeah. Is my mic on? Can everyone hear me? So in New Hampshire, we do have the New Hampshire State Cancer Registry. It's managed under contract by Dartmouth. All cases of cancer for New Hampshire residents that are diagnosed either in New Hampshire or we have agreements with other states to receive that data are reported to the New Hampshire State Cancer Registry. If someone is diagnosed, or if someone moves out of state, had lived in New Hampshire for their whole life, moves out of state and is diagnosed there, it wouldn't be sent back to the New Hampshire Registry because it's only for residents at the time of diagnosis. So there's not a residential history within the registry. There is a limited amount of occupational data collected in the New Hampshire Registry, but not specific location.
Okay. That certainly presents a challenge.
Thank you.
Thank you, Dave.
Good afternoon. My name is David Caswell. I served here as a traditional guardsman from 1968 to 2003 in aircraft maintenance. Most of that time moved into the office a little bit later in the career. I'll direct this to the table to the right and bring up the issue so that at least it's on the record. I just heard them mention, you know, if you're only a resident of New Hampshire, that's the only way it's going to show up. I only see New Hampshire names on that memo up there from Congressional District. As I said, I was a traditional guardsman for 33 years. My regular job was at the Portsmouth Naval Shipyard. I worked there for 13 years, full-time, in the trades, as a radiation qualified worker, working on the submarines, as a lead worker, because there's lead in the bottom of the submarines to keep them from flipping over. And years ago, when I worked there from 1972 to 1985, we were removing asbestos from all of the old submarines. So I was also exposed to asbestos. Like Dave, that just was up here, I had high PSA a couple of years ago. It didn't go way high, didn't think too much about it. Doc said, you know, until it gets over whatever the number was, you know, you're okay. And then last year, during one of my friendly exams, the doc said, I feel something on your prostate. Luckily, I went in and had the not too fun biopsies done, and it came back clean this time. But what I want to bring up is the issue of, and I don't know if I'm unique, I know there was a couple other folks that worked in maintenance with me that were traditional, whether or not part of this issue can be because we live right near a naval shipyard, and many of us work both places over our careers, that we can have a compounding exposure to all the chemicals that we were exposed to by the Navy working them, or in my case, the radiation exposures. I heard the Colonel mention, you know, the nukes that they were exposed to, a little different than a submarine nuke, which is a nuclear power plant. But just wanted to put that kind of on the record so that the folks at the table are maybe talking to the folks at a similar table in the state of Maine as well. Thank you.
Okay, I appreciate that. It's a good point. Thank you.
Hello, I'm Patricia Gammon. I am Roger Broder's widow. He served here from 1975 until 1998 when he died. He was diagnosed with non-Hodgkin's lymphoma after 2 years of being pushed aside, that the lumps that he had were to be expected because he was 40. And, you know, it's middle-aged fatty tissue. And it went untested until he went to another doctor for sinuses, and he says, I don't like this, please go back. He got the same answer, and then he sent us to a specialist. We knew we were in trouble when the specialist looked at him and said, we need a CAT scan right away. And when he looked at the CAT scan, he said, this is beyond my specialty, and got us into Mass Eye and Ear that very week. We hit a wall when the doctor looked at us, and he said, without an exam, this is cancer. He says, we're going to do a biopsy for, you know, formality. And we started treatment at Mass General. Over the course of the next 2 years, Roger went through untellable struggles, pain. He never showed it. I was the one to see it. But he did it with courage, and he went through surgery after surgery, many chemo treatments, much radiation. At a year and a half into the treatment, they said it was time for bone marrow transplant. His siblings were all ready to be tested, but they tested his and said, at that time, your bone marrow's clean, this is the best to do. So they harvested it, and they do what they do to bone marrow. He went through the bone marrow transplant late in summer of '97. In September, he was given the all clear. We asked if we could go and celebrate our 25th anniversary, which was that month, and they said, yes, just don't go too far and take it easy. And while you're there, toast to the next 25 years. 3.5 months later, he was gone. Towards the end, the cancer entered his bones. But during the course of this time, they told us, we don't know why it's back. Sometimes the cancer came back before it was time to be tested for the last treatment. They started talking about a secondary experimental bone marrow transplant, which at first they told us they never do a second one. Before they could set him up for that, the cancer was back, but they said, oh, the first time it went into one testicle, they said, it never goes this way. The second time they said, oh, it can't possibly be the lymphoma, but it was. So many of you know Frank McCutcheon, his wife, it was a nurse, and she did research on this experimental or new non-Hodgkin's lymphoma medication. So we went to the meeting with the doctor, and we were saying, no more bone marrow transplant. We want this medication. Then he told us, I'm the leading doctor that developed this medication. you do not qualify. It's for early diagnosis, non-aggressive, and yours is way too aggressive. And by the way, you have 2 weeks to live. I always thought it was connected to his service in Thailand, where Agent Orange was used, although he was in Thailand working on the planes returning from Vietnam. Roger would never discuss it. It was an off-limits discussion. We figured he was probably told as part of his duty he wasn't to discuss it. He took that information to his grave with him. I didn't connect it too much to peace, although my daughters had questions, until I saw the news that with Doris Brach on the Channel 6 News. That's when I found our beloved friend David Eaton had died. It was a tough night. And as I thought about it, it started to make sense what the doctors had said. We can't explain why this cancer is so aggressive. We can't explain why it keeps coming back. And they were baffled by the fact that it came back after a successful bone marrow transplant. Everybody here is family. God is family. They were so supportive to me, and they were there donating blood and platelets for Roger, the likes of what Mass General had never seen before. They came down by buses, and they had to say, we can't take any more because you guys have gone way over. And that's why I'm here, for those of you that are still serving and those that have served. I now believe that his service here at Pease made the cancer extremely aggressive. They had his doctor at Mass General conferred after the bone marrow transplant with the 12 top oncologists in the United States, because they had no idea which way to go. They came up with a plan that they thought might work because they had no protocol for what to do next. Before they could start the protocol that they agreed upon, it was decided it was too late because the cancer had attacked his bones. So the registry is really important, and look at all cancers, please, because I've heard someone had Hodgkin's. Roger's was non-Hodgkin's. Thank you for your time.
Ma'am, could you share with us where Roger worked? What career field was he? Maintenance?
Yeah, I'm sorry. He was with the 157th Refueling Maintenance Department.
Okay, that's what I figured. Thank you. I know it's painful, but it's certainly a story we need to hear. Thank you.
Sir, my name is Jared Mcgoldrick. I'm a traditional here with the 157th. I'm also on the civilian side an employee of the Department of Veterans Affairs, or the Veterans Benefits Administration. So I'm not here in an official capacity with the VA, but I want to tell everybody, if you feel like you have a disability that's related to your military service on this base, file a claim with the VA. I'm sorry that woman whose claim was denied, but please know, if your claim is denied, appeal. Appeal, get your more medical documentation together, and keep filing with the VA. If you have precancerous laboratory findings or something in service, we can find you directly service-connected through the VA. Presumptive service connection, which would be something that you get diagnosed with cancer years after you separate from the military, that is tougher, absolutely. That takes a lot of times an act of Congress. So we all know the Agent Orange Act of 1991, that mandated VA find presumptive disabilities like what we're talking about here. But for those people, we're adding new conditions to that list of disabilities that are presumed to be associated with Agent Orange. And those people that were denied, that filed claims for those disabilities 20 years ago, we can go back and we can grant retroactive effective dates for those people that had diagnoses for those conditions in the past. So please do not wait for a presumptive disability list to come out before you file a claim. File your claim now. If it gets denied, keep prosecuting that claim. Okay? I realize it's a tough situation. But I just want to let everybody know that, you miss 100% of shots you don't take. So if you feel like you have a disability related to service, file your claim, get it on the books, get it on record now. Get your medical documentation together. Thank you.
Thanks, Jeremy. Is there someone else who wants to share a story or concern?
Good afternoon. My name's Ken Lauder. I was here in the 509th back in the 70s, and I came down with this unit from 79 to 83, back on active duty, and retired at Pease in 90. I was back down here again with Pan Am for 6 years in the hangar down the ramp, and I was back here with civilian contract security forces from 2012 to 2016. Spent a lot of time here drinking the water. One thing that I was diagnosed in 2015 was stage 3 lymphoma. No history of cancer in my family at all. I was lucky, I got through it. But what I wanted to bring up, what has not been mentioned, which happened right outside your door here in 1990 when 1494 blew up and burned. It was brought to my attention after all this stuff has started showing up in the newspaper about what's going on. People started, Colonel Brooks was the wing commander at the time, the 509th, when we closed up down there, and I was running QA. He assigned me as interim investigator on this aircraft up here. And I can remember coming up here wading through the foam out there on the ramp. What was brought up to me just recently was an individual, apparently there are filter systems under the ramp out here that go out into Great Bay. He was in charge of replacing those filters and said that they found out at the time that the foam that was washed down the drains here did not break down in those filters. It piled up out there, jammed the filters, and they assume went into the groundwater here. Now, I'm not a chemist or anything like that. I'm only telling you what I was told, but he said that the chemicals, and I don't know how he knew this, that whatever is in that foam, apparently they don't, again, I'm not a fireman, they don't use it anymore, but at that time, those chemicals are what is being found now in this water to a degree. So just a heads up on that. I don't know, if anything like that going, but I'm just here to support everyone here who's going. I know a lot of you gentlemen here and ladies over the years, and I said I got lucky. I got through it, but others unfortunately have not. But definitely be checked, like everyone is telling you. I also worked at the shipyard, like Dave did a few minutes ago there for 4 years. I worked nuclear, I worked radiation over there, a lot of chemicals over there too. When I went to the VA, I did not go to the VA in regards to the cancer. I was there for something else, but they saw it in my records, and all they were interested in was Agent Orange, which I did not deal with Agent Orange at all during my career, but that was the only question they wanted to ask me about the lymphoma was Agent Orange. So anyway, I appreciate Doris, I appreciate what you're doing, and everyone here, Colonel, I appreciate it. Thank you.
Thank you. How about over to our working group members? Is there any information you're looking for, any questions you have? Well, back out to everybody. What are your thoughts on what you're hearing today? Mel?
I have a question for the working group. How long have you been running the cancer registry? And do you have any way of tracking and backdating information into it from the people who were treated just because they were active duty on base? When base was here, I was civilian consultant to the base hospital, but a lot of times the medical records stayed internal within the U.S. Air Force, and they didn't go outside into the civilian community, and it wouldn't get out into the state registry. It's sort of like an entirely different system. Can you comment on that and have any ideas how we may be able to capture that data to get a broader picture of what we're really looking at in the exposure? Because as I've listened today, so much of what I'm hearing is not just the recent stuff with the PFAS and the PFOAs, but also all the stuff going back to Pease as a SAC base.
So before things maybe become digitalized paper products, how do we know, when did the registry begin? Do we have any idea and how they would collect any of that data material?
Yeah, so don't quote me on the date, but it does date back to the 1990s. We have reliable data back to the 90s. We do collect data from the VA. You come to our attention that this is a national issue because of resource issues and capacity issues at the VA. There is a delay in obtaining cancer diagnosis data from the VA system, but it does make its way there eventually.
But there were people who succumbed just within the military medical system who never made it out into the VA. So that data may or may not be able to be captured at all, or would have to go to DOD to find out.
Yeah, they don't talk to each other, the systems.
Thank you. Other thoughts on what you're hearing? I'm certainly more concerned as I hear these stories. I would think most of you are as well. Yes, sir.
How you doing, sir? I just came here today to listen, and being a previous member of the unit, retired 34 years, spent 4 years active duty in the Marine Corps at Lejeune, you know, and places like that. I remember getting mailings a few years back about the water system there, and pretty much ignored them and didn't fill them out, asking me if I had any symptoms, because I don't have any symptoms. I've had 2 siblings, cancer runs in my family. I have 2 siblings that died at 53 of cancer. Fortunately, I made it to 57 and still very healthy. But the question is, I had an annual checkup recently. And I told my doctor, you know, I have a lot of cancer in my family. Is there any tests that you can do? And they was basically told, no, your cholesterol's okay, your blood pressure's okay, you're in great health, see you later. So one thing I would like to see to come out of this is there some type of test that we can be doing for people to see if, you know, instead of waiting until people get cancer and say, yeah, you got cancer, what can we do to be preventative or proactive, and what tests would they recommend after all of this? Is there a test that people who have been exposed to this that should be maybe, say, once a year or once every couple of years getting? I've heard of the test PSA values, and, you know, but again, I'm a person who don't usually pay much attention to it and just came here to support the folks that I worked with while I was here. Thank you.
Thanks. You bring up a good point. I'm going to jump on a limb here, way outside of my knowledge, but I've recently heard urinalysis can offer some insight to our health. Can anybody in the room speak to that at all?
There is some testing that urinalysis, but it's not across the board cancer. The one thing that I do know is there is a DNA test, costs $15,000, not covered by insurance, that can tell you what type of cancers your genetic makeup will make you likely to get. That I do know. On another thing, Lieutenant Colonel Gregory Bapp was my husband, and he started bleeding rectally at the age of 39. And he went for his flight, surgeon's physical. Hey, you got hemorrhoids, what do you expect? So the second year, same thing, you got hemorrhoids. The third year, they told him, will you suck it up? You've got hemorrhoids. Well, I was furious. So I took him to a civilian doctor who immediately got him the colonoscopy he needed, and he had stage 4 colon cancer. With everything I'm hearing here today, one thing that we've got to remember, that these are not just cancer patients. Those of you who are suffering from pain, pain can be caused by neurotoxins. How many people stand by a plane when the engine has started and breathed in those fumes? They have carcinogens, they have toxins, neurotoxins, the chemicals that you used in the base, neurotoxins, carcinogens. What scares me here today is that we're going to leave and someone is going to tell me, well, we have to collect more data. Well, if you want to collect more data, the first thing you have to do is test everybody. Test them for what they know the epidemiology is on these chemicals, and they know it. This is no secret. They can test what's in your blood. And I'm so scared that that's going to be postponed until someone gathers more statistical data. And the thing is, you know, if you worked in one of the hangars, every 90 days, it was tested to see what the toxin levels were. Where are those test results? You've got the data. You've got the data about the toxins. What we need is the toxins in our blood. What is happening here? What is your level of risk? There are look how many are here. Look how many did not come that don't know that possibility of their early dementia or their early Alzheimer's onset could have been caused by toxins here. And there's not only, once we get to that level, we have the whole other level of our children. Because I have one that has had weird medical symptoms since the day she was born. Nothing that they can put their finger on, but the kid's sick. And if you were exposed to toxins, chances are your offspring has some side effect from those toxins. Please, we need to find some immediate way of getting everybody tested. We have stories, yes. No one's going to bring back Greg.
So Pamela, I know you worked in the medical field, so you would advocate for a blood test, and we would be able to determine
without a doubt.
Toxins.
The thing is, you've got to be very specific when the doctor is ordering the test for the chemicals he wants tested.
Okay.
Because if you miss one of those chemicals, that it's not going to come back in the lab results. Also, you've got to be realistic. Who's paying for this? And how is it going to be dispensed? Is it going to be something done at the guard? Is it going to be something done at the private doctor's office? Then you'd have to get the private doctors on board.
Right.
And just from working in that field, I can tell you there's a lot of doctors that suspect something, but they need some kind of guidance for what they should be doing, some protocol that they can follow.
Okay.
I just want to add, there is a blood test that will detect cancer in your blood, and I've been trying to get it to be made part of your blood work. It's called a CA, I believe it's a CA-19 or a CA-125. It detects cancer very early, and they won't put it in with your blood work, and they should. And this is a fact. It's not, it's not some crazy story. There is a blood test that will detect cancer in your body, anywhere in your body. And I received the information from a lady who had breast cancer and had an operation, and then they told her she was going to have both of her breasts removed. And she went to another doctor, and she gave her this test. It comes from a Boston lab. And I called the Boston lab, and I said, why isn't this part of blood work? And they said, we can tell you why in one word, money. They said it could be done for everybody, and it detects it instantly, long before it becomes a problem. And people should be aware of this and should do something about that, because it's a fact. So she went to another doctor, and the doctor was going to give her this test, and the doctor was threatened, it was Portsmouth Hospital, that she wouldn't be allowed to do that, and she said, or we'll fire you. And she said, if you fire me, it will be in the newspaper tomorrow. So they allowed her to do it, and there was the woman that was supposed to have both breasts removed had no cancer in her body. She's still alive today. So it's important to know there is a blood test, and it would be included in your blood work. It wouldn't be thousands of dollars. It could be included in your blood work. So check that out if you can online or wherever. And I didn't know if I have something here I wanted to read just really quick. Is that permitted?
Yes, ma'am.
It's from the restoration program. It's just the thing that really caught my eye when I first started reading it. It said, from 1961 to 1971, burning exercises conducted at this fire training area were the main method of disposal for various POL waste generated on base. Products burned included recovered fuels, waste oils, spent solvents, some of which probably contained waste TCE. These wastes were reportedly transported to the site by drum or Bowser and dumped onto the training area, sometimes up to 1 week prior to a burn exercise. Since about 1971, only recovered JP4 has been used for fire training exercises at this site, with other waste POL products being disposed via contract. Training exercises are currently conducted about twice a week, with 1,000 to 1,500 gallons of recovered JP4 used per activity. Visual inspection of the woodland area receiving the fire department training area drainage showed a large area of dead pine trees, fuel odors were noted, and excessive fuel saturation of soil was evident. With numerous ponded areas of fuel visible on the ground surface. The drainage line from the burn area is believed to be functioning improperly, and fuel was periodically, it would flow overload into the low-lying wooded drainage area. The areas of acute vegetation stress is approximate 7,000 feet in size and is not connected by, by natural surface drainage to surrounding surface waters. The site is located approximately up gradient from the Haven Well. Site number 8 received an overall harm rating score of 82, due primarily to the known disposal of large quantities of hazardous waste, the known surface migration, and possible subsurface migration of hazardous contaminants off the site. Its proximity to an inactive on-base domestic well, approximately 800 feet. It's approximate to pristine natural environments, pebbly ponds, etc. Its proximity to the reservation border, approximately 600 feet, and the use and characteristics of the uppermost groundwater aquifer. They say that site number 9 is also primarily disposed of tires, stumps, brush, similar materials, and these were all affecting the water. There's so much information. I can't just go on and on.
I have a copy of that same report as well.
Do you?
I do.
Oh, that's good. Okay. All right.
No, I appreciate you sharing it with us.
Anyway, the blood test, seriously, just check it out. I'm not, I'm not making it up, and it's true. If they'd given it to my husband, he'd probably be alive today.
Hi, my name is Robinson Smith. I was an aircraft maintainer here at this facility with the 157th from 2004 to 2010. I'm one of the lucky few who actually signed up for the Department of Health and Human Services lab draw, and I have to say, I have not been at this facility for 8 years, and some of the PFCs are still at the 95 percentile. And these mirror the exact PFCs from the New Haven well, okay? I wrote up something concerning the industrial exposures here at this facility. I'm unfortunately not surprised to hear the negative health issues impacting our New Hampshire Guardsmen. These health issues and exposures were only addressed after Doris Brach brought her concerns forward to the media and military community. This led to the discovery of a large population of Pease retirees impacted by similar cancers. From my own personal experience working here at the 157th, I have observed a multitude of work practices that bring legitimate concerns from occupational exposures. For example, on the flight line, maintainers would routinely service the aircraft with hydraulic fluids and lubricants, a known digestive and central nervous system irritant, and then pour the remaining fluid from the servicing into the fuel tank on the ground generator to be burned. In the hangar across from Building 254, guardsmen were sweeping up spillage from damaged and labeled asbestos pipe insulation, a known pulmonary carcinogen, without any protective equipment or training. When the new fire suppression system was installed in Hangar 254, this hangar, the system was tested and required cleanup. Aircraft maintainers without any personal protective equipment pushed the AFFF foam out of the hangar with sheets of plywood onto the ramp. The installer, knowing the hazards of PFAS, was unwilling to perform this remedial cleanup. When washing the KC-135 aircraft, there was an ongoing issue of the aircraft soap, a known severe eye, gastrointestinal, and skin irritant causing the mucous membranes of employees to temporarily lose sensation of their lips, nose, eyes after exposure. In the wheel and tire shop, guardsmen would routinely vacuum the accumulated brake dust from the wheel and tire equipment, while the hydraulic shop would leave their hazardous work area containment door open in the summer when relining aircraft brake components. This subsequently exposed maintainers to heavy metals such as beryllium, which is linked to pulmonary and kidney cancers. And then there was the heavy metal contamination of Hangar 254 from sanding the aircraft paint containing cadmium, which has been linked to lung and prostate cancer. This is the very same place where the unit has historically set up their yearly holiday gatherings with their families in attendance. That's this hangar right here. All these exposures are in addition to the potential health risks from fuels, solvents, lubricants, hydraulic fluids, industrial cleaning products, and PFAS, which our guardsmen have been routinely exposed to. These examples unfortunately point to an incredibly poor, haphazard industrial hygiene program and the continued lack of adequate training, oversight, and stewardship of personnel. Collectively, these issues bring great concern about the culture of the 157th and its adherence to AFOSH and OSHA regulations. I would like to take a moment to ask several questions regarding the aforementioned practices. How has the 157th mitigated future exposure to industrial toxins and the subsequent waste streams at Pease? How has the 157th collaborated with the Department of Veteran Affairs to determine individuals exposed to industrial and environmental toxins at Pease? And what specifically has changed in the culture of the 157th to ensure compliance of AFOSH and OSHA regulations while protecting the health, safety, and welfare of our New Hampshire Guardsmen and their families? Thank you.
All right, thanks for your comments there. So some of your questions we might have to repeat again, but let's run through them real quick. Wonderful, but I'm going to hand it over to Amanda. And I think the first one was waste hazards, is that correct? Doris, if you want to hand those up to me or her, however you'd like to do that.
The first question was, how has the 157th mitigated future exposure to industrial toxins and the subsequent waste streams at Pease?
All of these? Oh, these are the ones I used. Sir, as the base industrial hygienist, what we do here, the typical protocol is to identify, assess, and control any of our industrial exposures. That program is in place currently. It has been in place for many years, and it will continue to be in place in the future.
Unfortunately, I can't speak to, I believe the dates you gave us was 2010, but I can tell you now we do have a proactive program, and I will give you an example. Amanda, you can help me out with some of the details, but we do routine testing. We do even blood testing of high-risk career fields in maintenance. In back of May of this year, we had detected some heavy metal contaminants in the very hangar that we're in right now. Now, when we did the testing, further evaluation, we did get help from the National Guard Bureau who came up. We found out these limits were well below OSHA standards, but we shut the hangar down for 2 weeks. We cleaned up the hangar, and we reopened it. We don't consume any food in here any longer or drinks. We shouldn't be doing that in an industrial area, so that's not a practice we do today.
That's very good to hear.
Regarding the second question, sir, how is the 157th collaborating with the Department of Veteran Affairs? We do have representation here today. They will be sitting in on our working group that we have established, and we'll continue working forward with them to ensure that they have the correct information that they may need from coming out of the working group.
And I want to make sure we're answering all of them. Was there something we haven't given you an answer on?
Yeah, so I'm just trying to make sure that hopefully it's not the culture at fault here creating some of these exposures. So I'm hoping something has changed in that culture to verify we don't have veterans sweeping up or guardsmen sweeping up asbestos, we have proper PPE in place, and we don't have a culture of cutting corners, pouring fuels, lubricants into generators, because it's easier to do that than actually have a program to manage it. Thank you.
No, we have a pretty strong, very strong waste management program, and I think we've been pretty proactive. Amanda, you might have to help me with the details again, but I'll give you another example of our safety office. Our ground safety had discovered some exhaust hazards in vehicle maintenance, and I believe we addressed that immediately. But Amanda, can you help me with some of those details?
Yes, sir. Whenever we have any sort of concern on base, we do address and assess any hazard immediately. Specifically to the vehicle maintenance concern that is being addressed currently. We have addressed many issues that have come up within the last year and immediately have taken action to mitigate the issue.
But continue with those questions, and I appreciate it. Thank you. If you feel like we still owe you some answers, we'll certainly we'll work on it as well.
Okay, so kind of like a historical background of some of this stuff. That's what I was talking about earlier. We didn't know what we didn't know back then. And I got to say that the programs that have been brought up through the years is basically something that's been happening. I was a superintendent for vehicle maintenance, and that's what they were talking about with the carbon monoxide type stuff there with the vehicle exhaust system. What I can say is over the years, probably maybe even since you've been gone, in the 80s, there was nothing. I can only speak to the 80s, so I can assume that 70s and 60s, there was nothing. Less than nothing, yeah, there you go. But as time went on, as I said, the Right to Know Act came up. Next thing you know, we started having inspections. And you may have been here, I don't know, but there were E-camp inspections. There were environmental compliance inspections. That started making people even more aware. When I first came here in 1991, one of the first things that I had done, because the Air Force had started noticing issues that had been going on, I had to do a wall-to-wall inventory of every chemical within vehicle maintenance. And that was going around here as well. And I can look around and I'm pretty sure that there's an MSDS station right over there that I can see. So this is the right to know stuff. As far as the programs go, this base has really taken on those programs over the year. They were a little weak at the onset, but as they go on and as they get educated, this is just another education piece. I believe that this base has really done a great job. They take it seriously. They try to, we wouldn't be here today if they didn't take it seriously. But as far as the work practices go, they were crap back in the 80s, and they had to be beyond crap earlier on. People were dumping stuff down drains, people washing floors with stuff, we were washing up in the stuff, as I said earlier. But as time went on, I remember the first guy that came in the vehicle maintenance, and all of a sudden, next thing you know, he's wearing the latex rubber gloves for safety measures, and people kind of picked on him for a while. Next thing you know, now it's a common practice. As far as waste removal goes, it is a big deal. You can't even spill a drop of foam from a fire truck on the ground without having to report it. So I can tell you right now that these guys are doing a really good job. And they're being educated as well as we go along, and that's just from my 35 years of experience. It's just been morphing over time as we become more and more aware of the stuff. They are taking it serious. And yes, I would be concerned for all the folks, the younger folks that are out there as well. But I know that the programs that they have now, I wish that I knew that back then. I really do. Because we wouldn't even be here today talking about this if we had done it. But.
And the chief just retired this year with us, so he certainly knows his stuff and where we're at right now. Okay, Amanda, can you talk to us about occupational surveillance?
Yes, sir. Occupational surveillance is a combination between the Bioenvironmental Engineering Office, which is where I reside, and the Public Health Office. Typically, what takes place is, again, we would go out to shops and assess any workplace hazards. We would then work with what's called the AMC, the Aerospace Medicine Council, from there. If we need to do any testing, all of that testing would be brought to AMC. AMC consists of bio, public health, flight doc, and is there anybody else on that program? Optometry. We work together to ensure that our members are being safe, and then public health we would decide there what type of occupational surveillance each individual shop needs. And if there's a reason for any, let's say, blood testing or to be on the respiratory protection program or annual audiograms, that's where that particular item would be decided. The shops would then be alerted. It would be written, whether in a memo or within the occupational health assessment, and the shops would then be advised from their shop supervisor.
Thank you. Thanks for sharing that.
Yes, sir. My name's Sergeant Glenn Patterson. I work in the aircraft structural maintenance shop. I've been there for the past 20 plus years, and I was active duty 10 years prior to that. So I've got a good amount of experience working with a lot of the chemicals that we're kind of talking about now. And I guess my comment to you would be, sir, that you asked a question a little while ago to somebody about what would you like to see going forward from this. I would encourage you, sir, that we have an opportunity going forward here with the KC-46 coming in and this new facility that's being built next door as a corrosion control and fuel cell hangar. We take advantage of that opportunity to do it the right way the first time, sir. One of my experiences through the years has been, as this technology, as this awareness has come forward, there's not been the money to come up with the equipment necessary to mitigate a lot of these hazards here. So my encouragement, I guess, sir, would be that going forward with that facility there, that we do it the first time. Because I'm afraid that if we don't do it and we take the shortcut on it, history is going to repeat itself. And there'll be another one of these meetings 30 years from now, and people will still be wondering why we didn't do what we could do. So I would ask that. Thank you.
All right, thank you. Do we have a mic? Kevin's going to grab one.
Thank you. My name is Tom Sherman. I'm a state senator from District 24. Next to me is Mindy Mesmer. We served together on the Cancer Cluster Task Force, which was put in place by Governor Hassan and then continued by Governor Sununu. And Martha Fuller Clark just left. She is your state senator for this area. I just wanted to let you know that we are here on the civilian side paying very close attention to this. We have currently at least 3 different statutory commissions, thanks to Representative Mesmer, that are continuing the work in the state on the PFAS exposure, including Pease and Coakley, which are our two biggest exposures locally. And thanks to the Colonel for inviting us here today. I just wanted to let you know that you can certainly reach out to Senator Fuller Clark or to me if you have any questions about what's happening locally. Ben Chan, who I think is sitting over on the side there, is our state epidemiologist, and he is working with us along with the Medical Society to look at whether or not medical monitoring is appropriate once somebody has been exposed to PFAS. So a lot of the issues that have been brought up today are being explored on the civilian side, and this is a very active concern that we are working on as a state.
Thanks for your support on that. I appreciate it. Yes, sir.
Hello, my name is Don Recker. I was in the 133rd Air Refueling Squadron from 1974 to 1993. Proudly served. Thank everyone that has spoken up today. It's about time. And thank you, Colonel, and everyone that organized this meeting today. My frustration, I had the blood test and had elevated levels and received the results in 2017, in March of 2017. And I made some phone calls to the state and so forth and asked my primary care doctor and other doctors what these results meant. And I got nowhere, and I just dropped it at the time. It's a year and a half ago. And the question I have, is there a resource now as a result of us signing up? Will we be receiving information about who to call, who to provide our test results to, and so forth? So it was frustrating to me.
So you mentioned elevated levels, but could you give us a little more detail? What?
I have a degree.
Was that like PFOS or PFOA, or?
I have a degree in engineering, and to read that chart is quite difficult. And even my own doctor said the same thing. And I've inquired with two other doctors, and they basically just said, don't know what to do, don't know how to help you. So.
All right, it's something we can pass on to our working group. So interpreting some of this data.
Yes, and a resource where we can call or write or email to find out what this actually means. Should we be alarmed? Should we not be alarmed? That's my frustration.
Okay, sir. Thank you.
Thank you.
Other thoughts? Items you want to share? Action items you're looking for that our working team can focus on?
Sir, do you know if they're going to open the testing back up for blood screening for the PFOAs and PFOSs?
I don't have any knowledge that it would open up again, so if someone in the crowd here does know that, please pass that on to us, but I haven't heard any press releases that would be reopened. I'm not aware of that.
There's a specific test that we have our children tested for.
Not being a medical professional, sir, I would know that. Something we can pass on to our working group. Specific tests. Okay, we're coming up. It's a little bit after 4 at this point. I will stay after and speak to anybody. But I want to give you all a chance if you have any final remarks to make, comments. I will tell you this won't be our only one. We'll certainly take what we've heard today. We'll have our working group develop an action plan, like I mentioned earlier. And once we get some headway, we will get information out using our registry over here. Again, it's not a cancer registry, but it's information. We have our social media sites. We'll have this on our YouTube if you put in 157ARW. And we will we'll make another announcement when we have some information to move forward on. I just want to thank all of you again for taking the time off to be here, to share some of these stories. Certainly it's painful, and they need to be heard, though. We do have some handouts, I believe. They should be on the table to my right as you leave if you want to continue with staying in contact as well. I want to thank our CODEL support. I think what we had up on the screen earlier was a big step, and that's probably where we're going to be able to push forward on. There's a number of questions. Again, we'll try to get that out to you. A number of questions on the second page that are addressing a lot of your questions as well and trying to get some answers. So with that, I will conclude the meeting and appreciate you all coming here again. Thanks very much.